So observationally, when we look at this data, we go, okay, well, diet quality is linked to the incidence of psoriasis. It's a leap of faith to say, okay, improving diet quality in a person who already has psoriasis will make it go away. That's the leap of faith, right? Like, and it's not, and let's remember, we're not recommending a healthy diet to our patients who have psoriasis. What we are unable to do, or we were unable to do, is say, if you eat this way, your psoriasis will improve, right? We weren't really able to say that. We're still going to recommend that they eat a healthy diet, but we weren't able to like tie it to a particular outcome because we didn't have that quite yet. Now, there is finally an intervention trial that's been published. So different than observationally when we say, eat, let's see how everyone's eating, who got psoriasis, who didn't. We now are taking psoriasis patients and we're feeding them a particular way to see if it improves their outcomes. So this paper, which is the acronym for it, or it's called the Impact of the Mediterranean Diet on Patients with Psoriasis. MEDISO is the acronym. Love the study acronyms always. And it was published recently in 2025. The author's name is Perez Butelli. So this is the first time that we have patients with psoriasis going through a particular nutrition plan over a 4-month period of time and tracking to see what actually happens to their psoriasis lesions. Okay. Previous to that, we'd really only had, like I said, observational studies that high sugar is correlated with increased risk of psoriasis, high saturated fat correlated to increased risk of psoriasis and worsening of psoriasis. But now we have this intervention trial. So the diet that they used or that they prescribed was the Mediterranean diet. They were very particular about the type of olive oil, or sorry, I should say by the amount of olive oil. And they actually donated the olive oil to the participants in the group and tracked their compliance with the olive oil. So their instructions were, med diet focused foods. They gave them lots of education about the Mediterranean diet. But the thing that they tracked the most closely was their olive oil intake. They tracked that actually weekly. And then at the end of the study, they did a Mediterranean diet adherence scores looking at the entire diet. But they actually were so emphatic about the olive oil that every single week, the participants had to like return their bottle of olive oil. And they were tracking to ensure that they had drank all of the milliliters that they needed to have to meet the guidelines. So the way that they structured this study, and one thing I think is so important for naturopathic doctors when we get a study like this is to look at the methodology, right? I've said it a million times. The magic is in the visit. They didn't just hand them a piece of paper that said, eat the med diet, don't forget the olive oil. I'll see you in 16 weeks. Over that 16-week window of time, the participants actually had 3 face-to-face visits and 4 virtual visits. So 7 visits in 16 weeks. And in those visits, they talked to them about their nutrition. They helped them troubleshoot how to like modify their, what they wanted to eat and have it fit into the Mediterranean diet context. They checked accountability, or they used the visits for accountability. So it was a mix of like strategy and accountability and checking in on the patient to see how they could customize the experience of the people getting, that information so that then they could go execute on their own, right? Again, naturopathic doctors we're in this weird place where we give people the scalpel, right? Like you don't go to your surgeon and they say, yeah, you need knee surgery, take this knife home and come back in 16 weeks. We do that, right? Like we give people the treatment plan that they have to execute. They have to do surgery on their own nutrition, right? Which is partly why I say that the magic is in the visit, because for people to have the outcome that they're looking for, they need the visits and the touch points with you to actually be successful at it. So they saw them 7 times in 16 weeks. Okay. It was mostly educational in those visits, helping them troubleshoot and stay on the diet. They also recommended, I said they emphasized the olive oil, 4 tablespoons of olive oil per day. And what came up in our office hours is that immediately the chat is like lit, right? They're like, how did they control for calories? And I love when people come forward with these questions because I would say 5 years ago when we started Confident Clinician, this was not common. Like that was not something that everyone necessarily thought about was is the intervention eucaloric now that we have prescribed a particular food to be eaten every day? How did it change or shift weight? How did it impact? Like the questions that came up from our current clinicians made me so proud of them because I'm like, okay, you guys get it. Like the replacement effect needs to be in effect here with this trial because we're adding significant caloric intake with this olive oil, but it was 4 tablespoons per day and then a med diet focus. So what the results were at the end of those 16 weeks were quite remarkable. For a dietary intervention alone, people weren't restricted from using their previous medications or cream, but they still had to have a relatively active PASI score, so the psoriasis scoring system, between 2 and 10. So it was mild to moderate, but they couldn't be in remission. They had active lesions when they started the trial. They were not prevented from using their medication, but they did track their medication usage over the course of the study. So for like a nutrition only intervention, what they saw was that 68% of people in the intervention group had a PASI 50. So what that scoring, how the scoring system works for psoriasis is we want to see like a 50% reduction usually in those PASI scores, which is looking at body surface area and severity of psoriasis. We want to see about a 50% reduction for it to be clinically meaningful. Okay, so like if the margins of their psoriasis get a little bit smaller, that's not enough for us to say that this was a worthwhile intervention. Okay, we want to see at least a 50% reduction. And 68% of the people in the diet group did achieve a 50% reduction in their PASI scores. And 47% reached a 75% reduction in their scores. So interestingly, it's kind of like if people benefited, they really benefit, right? So, almost 50% had a 75% reduction, almost 70% had a 50% reduction. So it was, a huge percentage of the people in that intervention group had a reduction in their psoriasis scores. And when they mapped them, the people that had high adherence were the ones that improved the most. Okay, so there was like a linear relationship or a positive correlation between adherence and improvement. The better they followed the recommendations, the greater their improvement was. And then the other thing that they saw was that the people actually reduced the frequency of their topical treatments. So this was not a recommendation, or it's not something that they said had to happen, but it is something they tracked, that medication use. And there was a reduction in medication use by 63% of the people in the intervention group, which it's such a great stat because often when patients come and see us, they have this this hope that maybe they can decrease their reliance on their topical medication. Whether we agree with that goal or not is, besides the point. Patients often want that as an outcome, right? They would like to be using less topical cream as the outcome. And in this paper, a significant percentage of the participants did have a reduction in their need for topical medication.